Hello everyone, my name is Adebayo Gloria Lawal. In this presentation, I'll be analyzing strengths and limitations of assertive communication. Communication is central to health and social care and is also considered as the backbone of health and social care according to Thompson 2018. If there is no accurate information exchange or a degree of empathy, then quality care is not going to happen. Effective communication helps patients, families, and other health and social care professions to provide information about symptoms, concerns, and wishes according to Silverman and Draper 2016. Poor communication may result in misunderstanding or ruptures in trust, and it can cause negative outcome in health and social care environment according to Budge and Arnold 1999. This presentation will be talking on assertive communication, which is a balanced and professional manner of communication. Assertive communication is defined as a form of communication that emphasizes clarity, being straightforward, and also considering the thoughts and feelings of other people with respect. Norton and Warwick, 1976. It implies showing confidence and being honest without intimidating and offending other people. Manolin and Moore, 2020. The verbal aspects of assertive communication include using calm words, clear explanations, and messages that shows respect to other people. Pipers and Gerardat, 2010. Apart from words, the non-verbal aspects like body posture, facial expression, and even the tone of voice contribute to message perception according to Hagi 2021. People who practice assertive communication make eye contact with people and listen actively to them, according to Sim 2017. It is particularly important for the sphere of health and social care as it helps to reach agreement and make decisions together, according to Silverman and Draper 2016. Strength of assertive communication. Assertive communication promotes clarity, confidence, and mutual respect. Pipers and Gerardat, 2010. In the context of health and social care provision, assertive communication offers numerous advantages and benefits. This mode of communicating allows better understanding when passing information in person. It reduces communication risk involved in transition period, such as during a patient handover or care plan discussion. It also increases individual confidence and promotes professional respect. It may include giving people accurate information about their condition and encouraging them to ask any question related to this issue, according to Silverman and Draper 2016. As a result, this will create a feeling of importance and worth. Birch and Arnold, 1999. Assertive approach allows for managing conflicts more effectively in situations where there is an argument amongst professionals and with families. Assertiveness allows productive dialogue and negotiations to take place rather than avoiding or confronting the problems, according to Malolin Moore 2020. Limitations of assertive communication. Assertive communication may be misunderstood as aggressive in some situations and cultures, according to Malolin and Moore 2020. It may also be difficult for anxious individuals or emotionally distressed service users, according to Sims 2017. Assertive communication can be ineffective in cases when people are under a great deal of pressure and cannot react adequately. Thompson 2018. It also demands confidence and adequate communication skills. Pipers and Gerardat 2010. Inexperienced and unsure practitioners have to be careful, and finding enough time for effective communications in some situations may prove difficult. Ellis 2021. Effective use in health and social care. Assertive communication is particularly effective during care planning, safeguarding discussion, conflict resolution, and patient education. This is because care planning is one such situation where discussion will revolve around various treatment options and choices available to the patient, along with ensuring that the patient understands the entire plan, according to Silva and Draper 2016. It supports accurate information sharing and informed decision making. In the case of safeguarding, where the professional might need to address issues or confront inappropriate conduct by another professional, then assertive communication would also come into play here. Challenges and ethnical considerations. Assertive communication may face barriers related to language, culture, power imbalance, or emotional distress. Thompson 2018. People's attitudes towards authority, assertiveness, and emotional display can differ depending on their cultural background. Huggies 2021. Professionals must recognize these barriers to maintain ethical and inclusive practice, according to Butcher and Childress 1994. Careful consideration needs to be put into non-verbal communication that includes various aspects like intonation or gesture that might mean differently for each person's culture, according to Birch and Arnold 1999. In addition to emotional states, disorders such as dementia may interfere with communication. Birch and Arnold 1999. To achieve an ethical interaction, a professional needs to take into account all these factors and avoid making assumptions. Careful consideration needs to be put into non-verbal communication that includes various aspects like intonation or gesture that might mean differently for each person and culture. Huggy 2021. Confidentiality is vital in any interaction, as well as respect and the decision of sensitive issue, according to Bishop and Childress 1994. Person-centered care. Person-centered practice recognizes that everyone has his or her own unique experiences, values, and preferences that needs to be considered while providing care. Thompson 2018. Assertiveness in communication is an indispensable aspect of promoting a person-centered practice, which forms the core of providing effective health care, according to Thompson 2018. Person-centered practice recognizes that everyone has his or her own uniqueness, values, and preferences that needs to be considered while providing care. Person-centered practice relies on the application of assertive communication that allows the individual to speak out what he or she needs in terms of health and social care in a safe environment. Pipers and Gerardat 2010. In other words, once the care practitioners is able to explain all the options and listen to the concerns of the individual, a plan can be worked out accordingly. In conclusion, assertiveness in health and social care is a highly important skill with a number of strengths and elements needs to be identified that may pose barriers to communication, so that these can be amended according to Thompson 2018. In assertive communication, strengths are expressed in terms of clear, confident communication, showing respect and working collaboratively in safeguarding and care, according to Pipers and Gerardat 2010. Using assertive communication is helpful when conveying care plan, conflict situations, patient education, and while working collaboratively. This is a form of communication that can enable person-centered care in terms of encouraging participation and choice, according to Silverman and Draper 2016. It's also a helpful way of ensuring that communication and shared responsibility for the work are improved, allowing for better collaborative practice. ALICE 2021. Continual reflection, training, and sensitivity to a person's needs will enable practitioners to communicate in an ethical and effective way in the health and social care sector, according to Bishop and Childress 1994. The references used throughout demonstrate the value of assertive communication in supporting safe, respectful, and person-centered care. Chen 2023. Thank you.